Two, three. Hey, everybody. We are separate today because I am out with COVID right now. I am on day 8 with COVID. So we thought today would be an appropriate time to talk about COVID. I'm sure everyone's tired of hearing about COVID, but we'll do this the last time. We'll talk about COVID, and hopefully as the
Mhm.
vaccine and the COVID rages around the country, more and more people will develop immunity, and this will be kind of forever gone. So the first thing I kind of wanted to talk about was my experience, because I think there's a lot of fear around COVID, and people just don't know how to react. And unfortunately, people are dying from this. It's a
Mm.
very small percentage, but we don't know who that percentage is that gets the severe cases. But so far, my case has been really mild. Like I said, I'm on day 8. I had started out with just kind of general feeling bad and some dizziness. And then by day 3 or 4 is when I was really fatigued, but I found that it's not as painful as the flu. I feel like the flu, you just get more
Pain
body aches, more pain.
wasn't as painful.
Mm-mm. It's just
Full
sleepy. I
achy.
was just tired all the time, all the time. And so I had
Mm.
spent Saturday and Sunday last weekend literally in the bed horizontal the whole time.
Yeah.
And but then Monday woke up and felt okay since. So I'm on day 8. Energy's been fine enough to work and do interviews and stuff.
And
And of course, I'm taking a boatload of supplements and peptides per my
yeah.
staff's recommendations. And tons of people online gave me plenty of recommendations,
Oh,
but
I'm sure I love internet doctors. They're very sweet. They are.
they
They
are.
are.
And so ultimately, there's only so many things you can actually put in your body. So I wanted to kind of talk about that and talk about some of the things I used and what we're doing for our patients. But this is certainly not the end all be all of you must do this and nothing else will work. I think too often people try to supplement with everything when they get sick with COVID. And the truth is that your pre health or your pre COVID health matters more than your current COVID health. Like once you get
Mhm.
COVID is not the time to start eating salad. I mean, yeah, sure,
You
but it's
should,
kind of
but
too late.
yeah.
And so there's been multiple studies now linking a healthy microbiome to a decreased severity of COVID. So I'd like to believe, my stool study doesn't agree, but I'd like to believe I have a healthier microbiome,
But
and
you
that's why.
did you did more work after you're still steady.
Yeah, that's
Like
true.
we
That was
we,
a few
we
months
upped the
ago.
antics, yeah. So you reduced inflammation, added in good microbiome supportive foods, which we'll talk about. But I mean
Right.
that is the purpose of like I'm glad that you're talking about it because we all know what happened last year. And I was nervous personally for you to get COVID after you had a chest tube from pneumonia, but I think,
Literally almost to the year. Actually, tomorrow will be
oh,
an
no way.
anniversary of when I went to the hospital. Yeah.
Oh my God. Okay. Well, there we go. But yeah. And so then I think there's almost more fear and anxiety about it because you do hear
Yeah.
about the horror stories. But I think that yours is an example of case of you had a horrible hospital incident last year, but then you
Hmm.
did some more testing and, looked at your body and your gut and your inflammation and you changed it. And you did
Hmm.
an AIP diet, you did everything
Hmm.
you possibly could. And then now look, you have COVID. And honestly, it's probably the best case scenario with you.
Yeah.
And
Moving
it's
on
good
pretty
to,
quickly.
yeah. So at least show people you're right. It's what you do before you get COVID. Not
Hmm.
that all is lost, but when you do get it, if you haven't
Right.
been doing
Right.
anything. But yeah, you definitely have to lay down that groundwork.
So one of the things we want to remind everyone is that we put together a COVID action plan for people that
Mm-hmm.
are nervous and want to take supplements either before or during their illness. And so you can go to our website, oubemedical.com/COVID-19 without the hyphen. And you can fill out your information, and an automatic email will be generated that's sent to you with our action plan and stuff. But I wanted to highlight a few things from the action plan. And number one is that vitamin D, although we've heard about vitamin D for years and years and years, it really does seem to be a big component of
Mm-hmm.
your pre-sickness vitamin D levels matter based on your severity of COVID. And so our vitamin D level for everyone is over 60. It doesn't matter how old you are, we want a vitamin D level over 60. And then there's new data actually suggests that if you take 50,000 units every day, what was it, for 7 days or 10
Yeah.
days? Doesn't matter, somewhere around there. While you have COVID, you actually have better outcomes too. So I did
Yeah.
that, even though my levels were already over 60. The 50,000s are supposed to be once a week, but instead you take them every day while you're sick. And I've been doing that with COVID. And you can overdose on vitamin D, but it takes a lot. So you don't really need to worry about that. So if you take it once a day for 7 days, 10 days max, you're not going to necessarily overdose. So make sure to do that. And then number two is that ivermectin's gotten a lot of attention. That didn't really make it to our action plan because it's not a supplement; it's a prescription you'd have to get from your pharmacist or your doctor, and then the pharmacy. I've heard of people getting it from the horse store. Apparently, it's a
Excuse me.
well-known medication for horses. I don't know what a
Excuse
horse
me.
store is, but apparently they use it for horses.
Like I'm
But
taking her ivermectin and I'm washing my hair with the horse shampoo.
you can have a
Got some horse
mane.
CBD. That's wild.
So the horse store, I don't
The
know what
horse,
that is, but you
where's
got to
that?
make sure to convert it for human dosages because humans are a lot smaller than horses, in case you didn't know that.
Oh, good.
The usual dose is 3 milligrams once a day for 5 to 7 days. But I've seen all kinds of regimens out there, 15 milligrams and whatnot. And truth be told, I don't think we know all of it, but at least if you get some in, that might help.
Can you touch base real quick on just like a quick synopsis on ivermectin? Am I saying that right? Because I don't
To
say
be
it
honest, I
right.
don't even know the mechanism behind why it helps with COVID. I
Okay.
saw the research and I've just kind of fell out of favor of researching COVID to death because I just feel like we've got so many more people we can help with autoimmune issues than COVID
Right.
right now. So all I know is that ivermectin has proven beneficial. It is an anti-parasite drug.
Yeah, that's what I was gonna ask.
So check your poop for parasites when you're on ivermectin, just in
Did you
case.
have one?
I didn't see any.
Oh, bummer. I wanted to see.
Big
Wanted to
tapeworm
see.
come out.
Yeah. COVID.
So side benefit of taking ivermectin. Now it was a full moon and it was a wolf moon. It was a wicked looking moon while I was on ivermectin. So that always helps with parasites if you take it during a full moon.
Yeah, yeah, yeah. Interesting. Did you feel more fatigued taking it during a full moon? Maybe.
Well, oddly enough, I started ivermectin. Let's see, first day of symptoms was Wednesday. I got ivermectin by Thursday, and by Saturday, Sunday, I was in bed. So I don't know that it was necessarily ivermectin or parasites
Okay.
or COVID or whatnot. But Saturday, Sunday, I did not get out of bed at all, other than to use the
Interesting.
bathroom and eat, because I don't skip a meal ever. Um,
Never. Why would you?
and luckily, I did not lose any smell or taste, other than this terrible
Good.
nasal congestion. So I can't taste everything, but it's not
Mhm.
the obvious loss of smell and taste that happens with
Yeah.
COVID. Last but not least, of course, are peptides. We've been doing a
Mhm.
lot of work with peptides lately, and they're getting much more popular and finding a lot more benefit with it. So my staff put me on. I gave them permission to treat me. I did not treat myself this time because
Yes,
last
we
time that
did.
ended in the hospital.
Yes.
So you guys put me on thymosin alpha, thymosin
Right.
beta, and a mega dose of BPC.
Yeah, we
And I
did.
did not do my peptide today yet.
Oh no.
Bad doctor.
I
And I
know.
didn't take
Is
my
it
supplements. Okay.
okay? You have to do it right after we get off. Yeah, so we did the 30 units of BPC twice a day. We did that
Which is a
mostly.
mega dose because
It
normally we
is
do 15 units once a day.
once a
So that's
day.
literally
Yeah.
quadruple the dose.
And that was mostly, I think, related by weight. Um,
Or what are you
so
trying to say? Are you
I used
saying,
it for my weight and I just gave
oh,
it to
okay.
you. So, so if anything, I'm putting myself under the rug. And then we did thymosin alpha at first. So, and we had you ramping up, right? So
I
eventually
did
it
the
was,
50 units,
yeah, 50 units for 3 or 4 days. How many did you do?
3 days.
3 days. And then we're down to 15 units.
Hmm.
And then that's what's a supercharge. And so for anyone who doesn't know that, thymosin alpha helps with intracellular pathogens. So killing off inside the cell and increasing, all of your immune basically reactions to help fight something off. That's the simplest way of
That's
saying
always
it.
a fascinating thing to me to think about intracellular pathogens. And
I
so
know.
we typically think of bacteria and everything on the outside of us, but there are certain bacteria that are small that invade our cells and live inside of our cells. We typically think of viruses as inside of the cell and everything
Right.
else is outside of the cell. But Lyme disease, syphilis,
Mm-hmm.
chlamydia, not the chlamydia you typically think of with sexually transmitted diseases, but all the other chlamydias out there are actually intracellular pathogens that
Yeah.
live inside of our cells. And so that could be another reason why I was wiped out Saturday and Sunday. I've never done thymosin alpha before.
Yeah.
Who knows if I had some Lyme or something going on in the background, and the thymosin alpha just supercharged me. So that's one peptide we have to warn people about. That
Yeah.
BPC is like no one ever has side effects with
Yeah.
BPC. That's just all wonderful and nothing bad
Yeah.
from our experience. But thymosin alpha has been a powerful one that you want to be weary of side effects. Not that they're bad; it's a healing reaction. But if you're stuck in bed, that may feel bad.
Yeah, and depending on what your previous medical history is, right? So I think
Hmm.
there's a couple office staff, myself included, who have substantial medical history with mold and other biological toxins and things like that. And the small dose of 15 had us wiped out into
Hmm.
total sympathetic overdrive. but then half the dose was okay. And so usually in the practice, if you're using it not for COVID, you start at like 5 units for a few days and increase to 7.5 and 15. So yeah, if you're doing thymosin alpha with anyone that's outside of our office, just make sure that you know that and that you're aware of the dosages, and don't just jump into 50 units if you have to. Even ease yourself up. We had a patient who did that, ease himself up, and he did great. And then thymosin beta, I love thymosin beta. That's some good cleanup outside the cell. It's kind of, I feel like thymosin alpha and beta, they're a little baton handoff, like they help each other and they're good. You always want thymosin beta before you do alpha, and it kind of builds up on each other. So you start with BPC and beta, and then you add in alpha for a little bit, and then you cycle through it. And that was 25 units a day of the beta. Yeah.
And so the thymus gland hasn't gotten a lot of attention over the years. I mean, our discussion in med school of the thymus probably included about 30 minutes, and like, and that's it, moving on.
And you're like,
and so,
my thymus.
yeah, well, you know where the thymus is. I think there's doctors out there that don't even know where the thymus is. So yeah, it's above the heart. It kind of shrivels over time. It's really profound in children, and then it shrivels up over time after the immune system is really taken off, and then it just kind of disappears almost. And so, but it's still very active in adults and making the immune system. So if you've got COVID or even not COVID, I mean, we use those thymosin peptides for much more than just COVID, although it's gotten a lot more popular with COVID.
Yeah. And if anyone's watching this and they are interested in getting help with COVID, you don't have to be a patient to get peptides, but you can schedule a free consult with Mimi and just kind of get a nice opinion for your case. So be careful. Don't buy peptides off the black market.
Yeah, you just don't know what they're tainting it with. Yeah.
No.
And then last but not least are, of course, infusions for COVID. So I put together a COVID protocol for infusions, even though I didn't do them. I wanted to, but these poor veins have been tortured over time. So I gave them a break, and luckily recovered fine without the infusions. But one of my other friends who got COVID did the infusions, and he's doing better than me. So
he felt so good. He's like, I feel amazing. And I was like, we need to do what we're doing now for your continuous care. And the fact that he had COVID, he's like, this is a great 2 days, Aubree. And I was like, I love you. I don't even know. Like, the fact that you just feel wonderful. Yeah. Those infusions they're powerful. And I like the balance that you have too. It's not just full on vitamin C and Myers and glutathione. And have the different balance that's going to be supportive, because you can't push your body too far.
Right. It's not mega dose, and it's not too hard. It's just kind of smaller daily doses. Actually, that was one of the questions he asked me. Is like, why is the glutathione dose so low? And I told him that we're not trying to detox you. We're trying to maintain your antioxidant potential, not heavily detox and stir up trouble. So it's actually quite a different infusion protocol than a lot of our other stuff, which is high dose and pretty powerful. And then last but not least, of course, is the discussion of the vaccine, which is always a heated debate. But I want to make sure to at least broach that subject and talk about, as most of my followers know, I'm not the biggest anti-vaxxer, but I am well aware that there are harms to everything we do, whether it's the car we drive or the lifestyle we live. There's risks and benefits to everything we do. So if you're someone, so basically the vaccine decision is a risk benefit decision for everyone individually. And so what I'm typically telling people is, if you're over 80, the risk of having a harm from the vaccine versus dying from COVID is a no-brainer. So if you're over 80, you should be getting the vaccine and not really asking any questions. Are there potential hidden side effects and harms that we don't even know about yet? Yes, that's a potential issue. But we know of the issues with COVID, and we know the mortality rate of over 80. And so it's really a no-brainer that you just need to do the vaccine. If you're over 60, that is, my recommendation is still, like, if you're over 60, you should most likely consider getting the vaccine, because the mortality rate is still high enough with over 60. And then the below 60 crowd is kind of up to you, wherever you feel like you are. The big thing I like to warn some of my patients is that they're such on-the-go people, go, constantly everywhere, that if you get COVID, you don't get to plan when you get COVID. You just got it, and boom, all of a sudden you're quarantined for 2 weeks, no questions, concerns. Whether you had travel plans, whatnot, you were toast, dead in the water, or not dead in the water, that's terrible. But you're down for the count, right? You're quarantined. And so I've warned several of them saying, look, you may not want to get the vaccine, and I'm sure you'll do totally fine with COVID. But at least if you get the vaccine, you get to choose when you go down, because many people, we've had several patients who are down for the count for a day or two after the vaccine. but at least they knew that. They knew I'm getting the
Yeah.
vaccine on this date, and I may be down for the count for a day or two. And then of course they don't have to fully quarantine, and they don't have to worry about giving it to their mom, dad, whatever it may be. So there's a lot of decisions that should go into that, whether you get the COVID vaccine or not. And of course, even if you are over 60 or are over 80, if you're doing a stellar job of quarantine, then there's a low risk of getting COVID. So you might be able to dodge the vaccine and dodge all the potential risks and harms. But I always want to warn those people that quarantine has an effect on our noggin. We are social
Hmm.
creatures. We are supposed to mingle with our friends and our peers and our loved ones. So don't let a vaccine scare you so much that you quarantine yourself into a hole and then lose
Hmm.
your mental happiness and your joy and stuff for that. That doesn't seem like a win to me. So if you're choosing not to get vaccinated and yeah, anyway, that's enough on that. So far, I have had my pulse, my finger on the pulse as far as side effects and things with the vaccine, watching the anti-vax channels and things. And I really haven't been too impressed with some of the hidden side effects and warnings that are coming out with the vaccine. I really do think it's actually turning out to be fairly safe and not too scary. Um, so
Yeah, yeah. I don't
if
know.
you are going to be the person to wait it out, I do believe that luckily it seems like coronavirus has not mutated enough to where it will be one vaccine or one infection kind of eradicates it. So I am hopeful at this point that we will be able to eradicate COVID-19 from the planet and never have to deal with it ever again, because I believe enough people are getting infected and enough people are getting vaccinated that eventually it will just kind of peter out and disappear. And it
Mhm.
hasn't mutated enough to where it will be an annual thing like we've had with the flu. That was the big concern in the beginning, is that this is the new post-COVID world. But I'm hopeful with the vaccine, and they're not talking about not effective for all the strains. They're talking that it's effective for all the strains. That means we could have a post-COVID world that is not COVID annually.
Yeah.
That'd be
Right
nice.
on. Yeah, that
That'd
would
be
be nice,
nice.
wouldn't it? I know. I know.
So
So,
I think we've talked enough about COVID. I certainly don't want to beat the horse, but people have been asking what my regimen was and stuff, and I didn't do
yeah,
anything special. I did what's on our COVID action plan. I did the peptides. I skipped the infusions, much to my regret.
I know.
But I also didn't want to expose my staff to COVID. I would have felt terrible if someone gave me an infusion and ended up getting COVID.
Yeah.
Um, so
Yeah. Thank you.
I'm ready to get back to work. I
I
miss you
know.
guys.
I know we miss you too. It's weird. I mean,
You're lying.
we're estrogen dominant here, so we definitely need some testosterone immediately. But I know you're missed here, and it's a different. It's not. Yeah, it's not the same place. But we're thankful you're not exposing us. So
Are you enjoying my office?
I like your office. I'm not gonna lie. I think I like my office more.
Oh.
I know, but I
Once it's
also
set, you mean once it's actually set up
it
and
is
running?
set up now. It's
Oh, okay.
beautiful. Aiden loves my office so much. He's sitting in there. But I
Oh,
get the nice, but the window hits me. And I think after being in Portland for so long and not having the sun, that the sun's directly on my face. And so I feel like a little flower and I'm just happy. Like, okay, it's good. But so when are you done quarantining?
so my 14 days. So the CDC's current guidelines are actually 10 days from first day of symptom, but we're holding by the 14 days just to be
Okay.
overly cautious. So next Wednesday, so I got 6 more days of quarantine. I'm going to loosen up my social quarantine a little bit to people that are willing to take a little bit extra risk, but it's 10 days. So my 10
Yeah.
days ends Friday, basically, in 2 days.
Nice.
Tomorrow.
Oh, good. We get it back.
Yeah, but I won't be back in the office until Thursday,
Okay.
just in case.
Good to know. I'll clean up.
Get out of my office.
Sorry. Cool.
All
Well,
right. Well, everybody follow our channel, subscribe to our YouTube, check out our website, go to the oubemedical.com/COVID-19 if you want to get the
yeah.
action plan. Hopefully this will be one of the last discussions we have on COVID, because it should be getting better and better here. And
So
we'll see you around.
cool.
Bye.
Bye, guys.